And welcome back. You're watching KTN Business Today. We now enter into the second part of our show where we want to get into an interesting conversation around the pharmaceutical industry as well as the key developments that we have witnessed as a country. And I'm joined by an interesting panel from Good Life who will be speaking to us about this all-important subject. I want to quickly introduce this particular panel. On to extreme left, we have Martha Osier, the investment manager at Catalyst Principal Partners, a private equity firm that actually does quite a lot of work in East Africa. Just seated next to her is Karen Gikunda, the chief marketing officer at Good Life. And on to just next to me is Dr. Sijal Shah, chief pharmacist. Welcome, ladies.
Thank you.
It's a pleasure to have you. A lot of developments have happened across time in the pharmaceutical industry in the country and also in the region. Perhaps, Karen, if you had to kick off this conversation, how has been the industry like? And tell us a little bit more about Good Life. I also know there's a lot of inferences being made with Mimosa.
Yes. Good Life is a chain of pharmacies that is across East Africa. We have 16 branches in Kenya and one in Uganda. What we'd call Good Life is more of an acquisition and a greenfield strategy, expansion strategy, where we have acquired not only Mimosa, but convenience store models that we have Dove Chemists, which have 4. We have Eldo Chems, which are also in the malls, and then, of course, the Mimosa. So in total, we are 17 in East Africa.
Interesting. Still keeping it with that, these acquisitions were done within what time frame and what drove the company into going into this niche?
We are not only a niche, but we also offer pharmaceutical advice and services to the middle class and upper class across board. And we are not only in Kenya, but also in East Africa, as I said. But more so, what you'd see with Good Life expansion is that we're in every single town, and we're expanding in every single town. In Nairobi per se, we are in Lunga Lunga, for example, and also in Westlands. So we are covering cross-border of customers.
So what's been driving the growth story for you guys?
I think Martha could answer that.
Oh, yes.
Yes, actually, we as Catalyst, we made the investment in Mimosa Pharmacy in 2014. And our strategy was to use that as a platform to start what we would say is a consolidation in the pharmaceutical retail sector. So as Karen mentioned, since then, we then acquired Dove Pharmacy, which are located at petrol stations across Nairobi. And then we've also acquired 2 shops from Eldo Chem Pharmacy, which had shops in the mall, in Greenspan Mall, and one in Nyali, Mombasa. So for us as investors, we have been attracted to this sector because, as you know, Abby, the healthcare sector has been growing very rapidly. We expect that by 2019, the total pharmaceutical spending in Kenya will reach up to $1.2 billion. And this spending is supported by, as you know, a rising, growing population with rising incomes. And particularly for healthcare, we have in Kenya both a growing burden of disease for communicable diseases and non-communicable diseases. So based on these factors, we expect that there will be continuous spending on healthcare, on medicines, and this is why we decided to back Mimosa, which we have now rebranded to Good Life, because we believe they would be the leading pharmacy in the region, providing quality medicines to address a number of the health ailments that are affecting this growing population.
And just before we come to Dr. Shah, you've been a bit quiet, but we're coming to you. Martha, how much did you sink into this particular investment?
Generally, at Catalyst, we invest anywhere from $5 million to $15 million. We continue to support the business, and we will be supporting the business to grow. Today, as Karen mentioned, we're at 17 shops. We expect to double by next year. So next year, we'll be looking at around 30 shops or more, and call it by 2018, we would have reached, close to 50 stores. So this will continue to be a growing investment for us.
Dr. Shah, you are a chief pharmacist with Good Life. From the lens of a pharmacist, how would you describe the growth of the pharmaceutical industry?
I would like to share and quote what Professor Dr. Kamarogo had said. He endorsed at our Pharmaceutical Society of Kenya meeting in May this year that the way forward is retail chains of pharmacies, and with partnerships with private equity, public-private partnerships that Good Life is part of one.
Yeah.
We're able to, and that is how Good Life is born, and we are a chain of pharmacies. And with this significant change in the pharmaceutical sector over time, we seek to be the preferred choice of pharmacy. And how do we do that? Why are we different, for example? Because we work very closely with our regulators, the Pharmacy and Poisons Board.
Correct.
All our premises are to the standards as per the guidelines. We only stock registered products, and our staff are well trained to deliver and look after the clients. We serve and the nation one at a time.
And how has competition been really, knowing that this particular niche in the economy has a number of people coming in and wanting to make good returns in that industry?
If we talk about competition, as I said, the way forward is change, and with change you can have leverage and economies of scale, and that is how at Good Life we're able to offer quality medicine at affordable prices. So, and we stock the good, the better, and the best. So anyone walking into our pharmacy will walk out with a quality product at the right price. So we serve the right patient at the right time with the right product.
Maybe Karen, how important is pricing in the industry that Good Life is in?
Yeah, would say because we serve the middle class and the upper class, we say we give affordable prices. We do not pride ourselves on being the cheapest, but we'll give you the very best price for the right medicine. So we are not placed in a place where I would say we are competitively priced, but we don't offer low prices. We are well priced for the customer based on what we offer.
I bring up this particular issue of pricing because data has shown that access to healthcare is still at low levels across the country. Of course, in the urban areas, the numbers are quite promising in terms of how more people can access healthcare. Yes. But the other question is there's a lot of self-diagnosis being done by patients. They just walk into that pharmacy in the neighborhood, quickly pick a drug without even getting any prescriptions. How have you been able to maneuver your way around this?
So like at Good Life, for example, we offer value-added services, and these are professionally offered by trained staff. To say, as Martha mentioned, there's a big increment in both communicable and non-communicable diseases. So, like November was World Diabetes Day, and we were offering free blood glucose testing. So that's how we encourage people to walk into us and allow us, who have been trained and certified, to give you the right advice, the right knowledge, and the best way forward. And to extend that, amongst the services we offer are even like blood pressure testing. We do contraception. So the value addition, then and that trust and faith that you build into your clients will make them come back to you.
Martha, you deal with a lot of investing in such like ventures. What is now the biggest area of concern, looking at access to healthcare as well as cost of drugs? As an investor, are you concerned about this particular trend?
Well, as an investor, I think what excites us about the pharmaceutical retail space is that by consolidating and growing to, like I said, 50 pharmacies within a few years, we expect that we will be able to offer customers, affordable prices and quality medicine. I think that's been quite an issue in this country. Yes, you can get cheap medicine, but at the end of the day, it might not be quality and your symptoms, will get worse. So as an investor, we are working very hard with the Good Life team to ensure that all our pharmacies have consultation rooms. So for those people who are self-prescribing, they have a space where they can go and speak to the pharmacist about their symptoms and get, the appropriate medicine that a medical professional would prescribe, given that we know, yes, in this country, it's hard to reach a doctor all the time. So a pharmacist may be your first point of call. So I would say we are not worried that much about pricing, but we do know that we will be offering at all our Good Life pharmacies medicine that can be traced, and which will be quality for for the price that's being offered, and with economies of scale, as Sejal said, we expect that we will be able to offer lower prices once we achieve that scale. Yeah.
And Karen, you talked about having plans to expand. Just talk to us, which other areas are you looking at? If you're to give us the counties, perhaps.
Yes. And the next year, we are looking to go into Eldoret. A few more stores in Nairobi. I think we have not fully exhausted Nairobi.
Yeah.
We'll also go to Nyeri, Nyuki, and look into Uganda more. I think Martha is looking into Uganda in a deeper way to solidify our positioning in East Africa so that we can be bigger, better, and offer better services. Yes. Yes. Currently, the greenfields that we have, over and above the acquisitions, we're in Kisumu right now. We are now in Lunga Lunga, offering that quality kind of service that has not been seen in Lunga Lunga, and then in the petrol stations which are rebranded now Good Life. Yes.
And Dr. Shah, the pharmaceutical industry is regarded as one of the most lucrative, because once you're in it and you have the substantial customer base, it's smiling all the way to the bank, isn't it?
That's right.
And of course, there's that challenge that is being posed by fake drugs. How will this sort of impact on the business you guys are into?
It will not impact us. As I said, we work hand in hand with our regulators, the Pharmacy and Poisons Board, and we ensure that anyone that walks into us, into Good Life, will walk out with genuine products, because we proudly say that we only buy or we only procure from the distributors, suppliers, manufacturers, our business partners that have registered products and are licensed with the regulators.
Actually, my concern is, I know you're into legitimate products. Now there's that other shop next door that is not. Does this worry you as people in this industry? Because in one way or the other, it's going to affect your sales numbers.
I'm not so worried, because as I said, people are becoming very well educated, well learned, and with so much marketing and so much publicity about counterfeit, substandard, then, as I said, getting the right medicine at the right time by the right people. So, I'm not at all threatened with that sector, that market. And the regulators are doing a marvelous job by, closing them down, crackdowns. So we're very confident.
Karen, you want to jump in?
As Sejal has put it, we are working hand in hand with Sejal and the marketing team to ensure that we are driving Good Life in the best light in terms of marketing, giving information every month on something new and something interesting about pharma through our digital space and also within the store. So you'll find that we are creating or innovating a channel that was not there before to educate the public on what they need to do for better health, better beauty, and a lifestyle that is Good Life.
From the perception that the market has of Mimosa, now that you are acquired, now you're Good Life, is that the products you're selling are sort of high-end and the prices are a bit high. How do you convince that mwananchi on the ground, perhaps they're living in Dandora and they feel like they want to get good medicine, but the perception is these guys are expensive. Maybe Martha, you can take that?
Yes, I think in our growth strategy, like I said, Mimosa was a platform for us. We've then acquired Dove Pharmacy, which are located at petrol stations. So they are on Awings Kodek Road, they are on Gong Road, they're in Langata, and we have one at Nyali petrol station. And we are also looking to be in clinics. We've opened in Lunga Lunga. So yes, we are trying to reach as many customers.
The bottom of the pyramid.
Yes, the bottom. I would not call it exactly the bottom of the pyramid, but I would say we are trying to, we will have different formats. So we will have your mall formats, we will have your petrol station formats where I believe anyone can walk in, and where if you go to the petrol stations that we have, their focus is purely on drugs. So I think that's a great place for people who maybe have a perception of, you know, shops in the mall being expensive. When they go to a petrol station, there it's very accessible to all. So I think we'll be able to touch on as many segments as possible, given that we did start out, you know, from the malls. Yeah.
I want us to shift gears a bit and look at the sector from a big picture perspective. If you are to look at the pharmaceutical industry, one of the other issues, of course, is incentives from government when it comes to imports, because a lot of the drugs are manufactured outside the country, in the likes of India, and the list can go on and on. As working in the pharmaceutical sector, what sort of government interventions would you like to see so as to enable investors to be able to recoup the investment, as well as tackle the teething issues in the society?
We would like that the local, they support our local industry and market, because we have manufacturers here, and we, you know, they are able to supply us with all the necessary medicine that is required. So, you know, if we support the local manufacturers and make vertical chain, then, you know, we can really reduce the cost to the end user. And that is what I would want, that more support into the local manufacturing rather than, you know, concentrating on imports.
And Karen?
I think we are working also closely with the international companies that are here locally to see what additional medicines they're providing. I think we are closely working with Sejo, and the meetings that we go to, looking at better, different packs that are out there internationally that customers are looking for, and how can we provide them easily and more affordably. One of the things we have been working on is smaller packs. You know, like sometimes packaging is a major issue, but how can we then be able to sell that product at a more affordable price? That's one of the things I think Sejal and I are working closely with the big companies, not to mention names. Yes.
Are there any that you're almost closing the deals with?
Not yet, but we are very, I mean, from January we'll be with them, with them, you know, the big players in this market, yes. And they are very open to our discussions, yes.
It's amazing how time flies. It's now time to get your closing thoughts on what else do you think can be done to see the health sector scale up to greater heights than what we have currently. Maybe we can start from here as we close.
I would want to see that, you know, basically to feel that person on you know, that's on the other side, and they're able to access healthcare, medicine at that affordable price, and knowing in the back of their minds that quality is there.
Karen?
I think our strapline is helping the nation look and feel good, one person at a time. I think we're looking for feedback from our customers and everyone out there. We have our website, goodlife.africa.com. Please give us feedback so that we can serve you better. Yes.
Yes, I'll echo the comments from Dr. Sejal and Karen. We are excited about this sector, and we continue to work with all the regulators and all the other stakeholders to improve the outcomes, and we will continue to support investment in the sector.
That's a good place to end the conversation. We've been speaking about the pharmaceutical industry, a lot of strides being made, And we didn't touch on the beauty products. We will get into that conversation a bit later on. We're speaking to Martha Osier on our stream left, the investment manager at Catalyst Principal Partners. And we also have Karen Gikunda, the Chief Marketing Officer at Good Life, as well as Dr. Sijal Shah, who is the Chief Pharmacist. Interesting conversations only on KTN. My name is Abiagina, and on behalf of the entire crew, we say have a pleasant afternoon.